Welcome viewers, welcome to Medico Virally. Today our topic of discussion is Hirschsprung disease. The name Hirschsprung disease was given after a Danish physician. There was a Danish physician named Hirschsprung and it was given after him. The Hirschsprung disease most commonly occurs in male babies. And the prevalence of the disease is 1:5,000 live births. And the Hirschsprung disease was also known as congenital aganglionic megacolon. And the name itself gives you an idea of the topic. Congenital is related with the genetics, and the aganglionic is absence of the ganglion, and this is the mainly related with the pathogenesis of the disease. And megacolon, and the size of the colon becomes increased. Here, congenital, the genetical association with the disease is there is an absence or underworking of Rett gene. And also in 10% of the cases, there is an association with Down syndrome. So this is the genetical information regarding the Hirschsprung disease we have to remember. And the pathogenesis of this disease is there is a failure of migration of neural crest cells into the bowel. Failure of migration of neural crest cells into bowel. So when there is a failure of this migration, there is an absence of ganglionic cells. Most of the cells are nitric oxide producing cells. So when there is the absence of these cells, the nitric oxide is no longer released, and hence the main function of the nitric oxide is relaxation of the muscle. And if the nitric oxide is not present, the affected part gets constricted and it cannot relax. But the part which is present proximal to the affected part is dilated, and the proximal part is dilated. This is the main pathogenesis which is related to this disease. On the top right corner, you can observe the image. That is, the normal image has no problem. It has the same distance, but the area where the ganglions are not present has been constricted, and the area proximal to this is over dilated due to the accumulation of the meconium and other particles. This is the main problem of this disease. So how a baby comes to your outpatient department, that is, the clinical features of the baby would be there is an abdominal distension which you can observe, and also the mother tells you that the baby cannot pass the flatus easily, leading to constipation and abdominal distension. And when the proximal part is over dilated, there is a chance of rupture of the cecum. So this is the main clinical features related with this disease. How would you diagnose this situation? The diagnosis of the situation is mainly by a rectal suction biopsy. So on this biopsy slide, you observe two main things. The first one is the absence of ganglions, and the second one is the nerve fibers have been hypertrophied. These are the main points you can observe on the biopsy slide. And radiologically, you can observe on when the baby is given barium enema. So on the radiological image, you can observe the following. The area that is constricted here is shown like this, and the area above it is overdilated as shown in the image. So this is the presentation which you can find on the radiological film. And what is the treatment options? There is only one option, that is surgical resection. The surgical resection means the part that is constricted or the part that is problematic with no ganglions and it cannot relax, this part is removed, and the part above it and this part is connected together. So this is known as surgical resection. And the main points regarding the Hirschsprung disease, I will quickly wrap up again. The Hirschsprung disease is named after a famous physician, Danish physician named Hirschsprung. This most commonly occurs in the male babies and the prevalence is 1:5,000 live births. It also known as congenital aganglionic megacolon. The congenital must give you an idea of an absence or underworking of the red gene, and 10% of the cases are associated with the Down syndrome. And the aganglionic is related to the pathogenesis, that is, there is a failure of migration of neural crest cells into the bowel, and the absence of the ganglion cells, mainly nitric oxide producing cells, and these ganglion cells are mostly that are present in myenteric plexus or Auerbach plexus, and the main function of the myenteric plexus is motor in nature, and hence there is no movement. The affected parts gets constricted and the proximal part is dilated. So on diagnosis, you can find a rectal suction biopsy. You can do the rectal section biopsy, and you can find two kinds, that is, there is absence of ganglions and the neural fibers, nerve fibers have been hypertrophied. And we have two types of stains that we also use during this biopsy. The two types of stains are acetylcholine esterase and the other one is calretinin. So the two types of stains gives you the difference between a normal and the Hirschsprung disease. So in the normal baby, the acetylcholine esterase is absent and the calretinin is present. But in the Hirschsprung babies, the acetylcholine esterase is more increased and the calretinin is absent. And the treatment options stay with the surgical resections. And I have all explained all the points regarding Hirschsprung disease. Thank you for watching. Kindly subscribe.